Patients diagnosed with epilepsy or seizure disorder have an increased risk of suffering from depression than the general public. Imagine, if you will, living with a monster inside of your head, an insidious beast with long tentacles that reaches and delves into every part of your brain, wreaking havoc on your day-to-day life in the form of uncontrolled seizures. That's what epilepsy feels like to some people. And if that were not enough, you add depression into that mix, the knowing that your disorder is going to disrupt your life in some way that day. The knowing that your peers might ostracize you for being different, and generally knowing that life for you is not normal in a normal world. A diagnosis of seizure disorder greatly affects the lives of those who live with it daily. However, there are many other side effects that go along with that initial diagnosis. One of those is depression. While the majority of my presentation is backed by research, I also have personal experience with the face of epilepsy. I have been an up-close observer to the havoc it can wreak in your daily life. My oldest daughter suffers from acute intractable seizure disorder, seizures that are ever present, ever debilitating, and ever insidious. One of the issues that can be caused by diagnosis of epilepsy is depression. Patients who are diagnosed with seizure disorder have an increased risk of developing depression at some point in their lives. This presentation will explore two possible causes of depression in epileptics: personal and social stigma and anticonvulsant medication. Personal and social stigma can lead to increased risk of depression because while epilepsy is a very common diagnosis, it's a very widely misunderstood disorder. The general public sometimes believes that those with the disorder are mentally challenged or mentally ill. Martin, 2004. Even as recently as a generation ago, people who had seizures were believed to be suffering from mental illness. And that misperception actually is true somewhat today. A possible cause for this belief might be that not all seizures are the convulsive type of seizures that people expect to see, but some seizures, such as petit mal and absent seizures, can actually closely mimic symptoms of certain diseases or disorders like psychosis, with the patient wandering around in a daze, maybe slurring their speech, or repetitively making certain words and motions over and over again. Additionally, people with seizures are commonly viewed as antisocial or overly aggressive. Bandestra, 2008. A very common symptom after a seizure is called post-ictal aggression. After a seizure, some epileptics can display physically and verbally aggressive behavior, struggling against their caregivers, seeming to fight them. Even though this period can be directly linked to the seizure, the general public overall has a lack of education about what seizures look like from start to finish. Social stigma often leads to personal issues such as low self-worth or self-esteem, and anxiety, which can then lead to depression. Because of these misconceptions, the epileptic is sometimes shunned and treated as a social pariah, again leading to low self-worth and low self-esteem issues. If controlling seizure disorder were just enough, the medications that are used to control the disorder can sometimes cause symptoms of depression and depression-related symptoms as well. There's a very common drug known as Keppra that's often given as a first line of treatment to a lot of patients. Keppra is known to cause symptoms such as hostility, increased agitation, moodiness, and aggression. This was taken from RX List 2010. My own experience with Keppra positively backs this up, as when my daughter was placed on this medication, within 3 days she began to exhibit aggressive and irritable behaviors. Clonazepam, also known as Klonopin, is another medication that's given to control seizures that can give you symptoms such as depression and aggression and irritability. Again, my daughter was placed on this to stop her status epilepticus seizures, and within a short period of time we saw the aggression and the irritability come out. It's good to note that within 2 years of taking both these medications and very many others not mentioned in my presentation, my daughter has since been formally diagnosed with depression and placed on antidepressant medications. At this time, I want to show you my tables that I pulled from rxlist.com 2010 that shows a placebo-controlled clinical trial, one with Klonopin, one with Keppra. It's interesting to note the psychiatric disorders in the group taking Klonopin over the placebo is greater. In specific, the depression group with Klonopin has a 7-to-1 greater chance of developing it than those taking a placebo. In Keppra, it's the same. Those taking Keppra have a 5-to-2 ratio greater risk of developing depression than those taking just the generic drug, or the placebo, pardon me. In conclusion, depression has many causes. People who have epilepsy can have higher incidences of chances of developing depression over the course of their lifetime than the general public. Since this is a known associated risk, those with seizure disorder are encouraged to seek treatment, be vigilant about reporting any symptoms that they have for the best medical management. Are there any questions from the audience?
Yes, I have a question. The question is, what is the percentage of epileptics that develop depression?
That's a very good question. 29% of all epileptics at some point within their life have a chance of developing depression. This is even higher than chronic and terminal illnesses such as cancer that carries a 25% chance of depression and diabetes with a 17% chance of depression. Are there any other questions?
I have one more question. How can social stigma be better addressed to help a person with epilepsy?
Again, a very good question. As is key to all disorders and diseases, public education is crucial to make sure that the general public is aware of what the disease or the disorder looks like. In particular, those with epilepsy can have a benefit if social education was given both in the school and in the workplace. Thank you.